I'm David Kerr, Professor of Cancer Medicine at the University of Oxford. Three things have collided. One, as usual, as is always the case at this time of year, I've got a cold, and so excuse me talking through that with my blocked up nasal pronunciation. Secondly, our British Medical Journal at Christmas time, as we approach it, accepts more laterally interesting papers, one of which I'll describe in a moment. And thirdly, this paper for me caused me to have a small wander down memory lane. The paper was brought forward by some excellent French academicians, and what they did was they undertook a sort of observational review, a sort of systematic review of the prevalence of being able to discover the Babinski reflex of response um, in a catalogue of 15th century Renaissance painters in the Christ child. Let me sort of unpack that a little. So they using Google, using established catalogues of fine art, they looked through at depictions of the Christ child by some of the most famous artists of all time: Titian, Raphael, Leonardo, Sandro Botticelli, Van Eyck, Albrecht Dürer. So some of the greats of the Renaissance. And this is coming at a time in which there was perhaps a more true depiction of the infant Jesus. Mannerist paintings did tend to depict the human body in a rather idealistic way, whereas those Rhenish and Flemish painters, as did Leonardo, sought to achieve something that was closer to an anatomic reality, trying to transfer real life to the canvas. Do you remember, those of you who are medics, the first time you elicited a Babinski response? This is a really important neurological sign that was first introduced by Babinski at the turn of the 19th century. Paris was a fantastic hotbed of neurological invention. Some of the greatest neurologists of all time came out of Paris. And Babinski replied, Babinski first described his reflex, and it's in those patients who have pyramidal dysfunction, and it's extension of the hallux of the big toe by greater than 30 degrees pointing upwards. If you stimulate the outside of the foot, then in the presence of pyramidal dysfunction or in infants, you get an upwards extension by 30 degrees or more. Now, I still have memories as a medical student, the joy of eliciting physical signs. There's just something quite magical about being able to demonstrate and to use the detective work associated with physical examination to track down sometimes obvious but sometimes subtle neurological defects. I know a lot of that's gone now with MRI scanning and with precise neuroanatomical location with these fantastic modern scanners. But I still remember the thrill as a medical student subsequently of being able to elicit a whole variety of neurological responses. And it just made me think of that. The paper was terribly well presented. They looked at a catalogue of over 300 Renaissance paintings. And what was interesting that they discovered in paintings of the Christ child, a babe wrapped in swaddling clothes, that in 30% of the paintings, the Babinski sign was present. So, how much truer to anatomy in real life could you find? And what was also interesting, not quite statistically significant, was that the Italian painters, who tend to be more mannerist in outlook, who tend to be seeking more of the ideal, were much less likely to show the Babinski reflex in the painting, in their depiction of the infant Jesus. It just made me smile, reading their careful analysis, looking at some of the pictures that they reproduced with permission in the BMG report. But it did make me think, one wonders when those shepherds and kings and wise men first gathered in that little stable in Bethlehem, whether indeed if they noticed at all that perhaps the new baby infant Jesus wrapped in swaddling clothes did show Babinski's side, and perhaps his big toe was pointing forever heavenwards. Who can say or who can know? Thanks for listening. Have a look at the paper. It's beautiful, and it just will make you smile. And for me, it took me back to being a wee medical student in Glasgow all those years ago. Thanks for listening. Have a good festive break. Have a good holiday, and let's look forward to perhaps a better new year, one in which we've got the fantastic advances coming forward of multiple effective vaccines. So let me wish you all the very best for the coming year. For the time being, Medscapers, over and out. Thank you.